the eye has been deviated dorsally in the proptosis in the bottom picture. The bottom one, the eye was still visual. The top picture, the eye was blind. So, I mean, how to deal with this? Well, if the extraocular muscles are ruptured or avulsed, uh, then we're going to get a strabismus. Conjunctiva can also be involved in torn and ulcerated. Um, if the optic nerve has been damaged, then it's like they've tried to enucleate themselves. Um, and it depends on the amount of damage. It's just a little bit of trauma to the globe. Just treat it medically and wait for the swelling to go down and see what kind of damage we've got. If it's much more severe, then eventually we're going to enucleate. But if the in the short term, um, uh, do a tarsorrhaphy, a temporary tarsorrhaphy, and treat them systemically and topically, and wait for the swelling to go down, and then see what kind of damage we've got, whether it needs to be enucleated or whether it's suitable for saving, still has vision or an or is blind. Horses hit themselves on trailers and stocks and so forth. There's an orbital fracture, one view at the top, and then you can see the arrows pointing at where there was a dorsal dorsal rim fracture in the bottom picture. Many of these don't. Nothing has to be done unless the bone is affecting the globe itself, affecting ocular motility, affecting the optic nerve. Um, this horse had right side supraorbital bone fracture, was fixed with a plate. Um, a lot of swelling in the upper picture, lid swelling. You can see the fracture in the CT on the right side. It also had really severe corneal laceration. You can see that. This horse also had another supraorbital fracture. Um, X-rays doesn't show quite as well. The arrow is pointed at where the fracture is. Uh, Ended up having to just really use our fingers and pull the supraorbital process back into its normal position. It was impinging on the globe, so we felt like we had to do something. This is another horse that was orbital trauma. It involved the cornea and the one of the sinuses. There's the corneal laceration. Here's the skin laceration. You can see exposure of bone. So it had orbital rim fracture as well. That got repaired uh, fairly easily, and then we did a conjunctival flap. But we're treating the sinus as well. The sinus was involved as well as getting treated medically. Here's the eye healing, not too well. Gets a conj flap. You can see in this uh, image at the bottom, you can see the break in the sinus on the left side down where the number 20 is, and gets a conj flap and gets sinus surgery to repair that, and did okay. Okay, everything did okay. Orbital tumors are notoriously bad in all species. Highly malignant generally, causing exophthalmos on the left side in this horse. The image on the right side of the screen, you can see there's a mass behind the eye on the right, on the left side. I'm sorry, on the left side, and generally the exophthalmics is so bad that they requires enucleation to try to save their life. But these can be highly metastatic types of tumors. There's the arrow is pointing towards the swelling and exophthalmos. There's the other arrow in the image showing the tumor behind the eye. Squamous cells behind the eye. These are bad things to do. I mean, we're trying to save the horse's life as long as possible in these, but just bad situations.